everyone. This is Bronx Borough President Vanessa L. Gibson, and I am proud to welcome all of you to the Union Community Health Center's Education and Health Symposium. The link between education and healthcare is truly undeniable. And today's educational webinar, we hope that all of you will learn about many of the medical challenges that may be impacting our students' ability to perform academically as well as their attendance. Our educators, our paraprofessionals, and so many that work in our schools every single day are truly working to make sure that our young people, our scholars are successful and the driven leaders that we know they truly can be. But we also want to make sure that they are equipped with all the resources and programs and wraparound services that they rightfully deserve to be our next generation of leaders. Today, we will be covering important topics for all of you, such as healthcare, mental health, asthma, vision impairment, occupational therapy, and physical therapy, and the impact that many of these areas could have on our scholars' academic success and their attendance. I hope that you will get the very best from today's webinar, and most importantly, share this information with your colleagues in your network. Together, we can truly educate all of our young people and make sure that they are the very best, ambitious, bold, driven leaders that we know they rightfully can be. Enjoy today's seminar, and thank you so much to the Union Community Health Center for having us today.
Thank you, Madam Borough President Gibson, for that wonderful introduction, and thank you for all you do for our Bronx community. My name is Dr. Vanessa Salcedo, and I am the Assistant Vice President of Pediatrics and Health Promotion at Union Community Health Center. Union Community Health Center is deeply committed to the well-being and success of the students in our community. We recognize the importance of addressing the medical challenges that students face in their academic journey. Because of this, it is with great enthusiasm that we present the Health in Education, Student Health and Learning for Educators Symposium. Today you will hear from our dedicated team of health providers in behavioral health, dental, physical and occupational therapy, optometry, and of course, pediatrics. Our objective is to equip educators with awareness and identification, action steps for assistance, and collaborative learning. Today I'll be talking about managing asthma for improved absenteeism. As a pediatrician in the Bronx, I understand the critical role that educators play in the lives of our students, and I'm here to share some valuable insight on the fundamentals of asthma and its impact on student absenteeism, along with the effects of asthma management techniques for students and schools. Asthma is a chronic respiratory disease characterized by inflammation and narrowing of the airways, which can lead to wheezing, difficulty breathing, chest tightness, and coughing. These episodes are mainly due to air obstruction in the lung that can be resolved on its own or in response to treatment. Unfortunately, asthma is disproportionately affected those residing in high poverty neighborhoods, and our children in the Bronx have the highest rates of asthma compared to the rest of New York City. And this is mainly because many of our families live in poorly maintained housing, which may expose our children to asthma triggers such as pests, dust, mold, and smoking. These environmental triggers can increase the frequency and severity of asthma symptoms and exacerbations. In addition, many of our children are more likely to seek care in emergency rooms where their asthma episodes are treated, but controller medications for the management of asthma and preventing further episodes may not be prescribed. All these issues are what our children are facing, which are leading them to poorly manage asthma, resulting in more frequent and severe attacks, leading to more absenteeism. Proper asthma management can help mitigate these challenges and improve attendance. There are some effective asthma management techniques for students and schools. Early identification is important, so educators should be trained to recognize asthma symptoms in students, which include coughing, wheezing, or chest tightness. We know that about 60,000 children attending public schools grades K through 8 in New York City have active asthma. In the Bronx public school, we know that there's a higher percentage of children with active asthma compared to the rest of New York City. And among these children with asthma, only 36% of Bronx public school children have a completed asthma medication administration form, compared to almost 50% of the other public schools in New York City boroughs combined. Asthma Action Plan and Medical Administration Forms, also known as MAFs, are completed by the medical provider and must be renewed every year to help confirm the child's asthma diagnosis, medication, and MAFs are also required for school nurses to administer medication in an event of an acute asthma exacerbation. Without a current MAF on file, nurses legally are not permitted to administer asthma medications. So, MAFs are a key to successful school management of acute asthma exacerbation in children and could contribute to potentially avoidable asthma-related ED visit. Another important factor is environmental control. As mentioned, identifying and minimizing asthma triggers in school and in home, such as dust, mold, and allergens, are important to control exacerbations. Luckily, we have a great program called New York City Healthy Neighborhoods Program, which is a home assessment for asthma triggers. And the student's healthcare provider can provide a referral to this program, which reduces indoor allergens and pests in the homes of patients with asthma. Physical activity is also something we encourage. Encouraging physical activity among students with asthma is part of a healthy lifestyle. So yes, children with asthma can participate in physical activity, but it's very important to ensure that they have their inhalers readily available during exercise. Another very important component is to check with your schools to have a clear emergency response procedure in place. First, it's important for the staff to be trained to recognize the student's asthma symptoms, as I mentioned, but more importantly, when these symptoms are severe and require immediate action. It's important to know the steps to take in case of a severe asthma attack, including having the child go to the nursing station or have self-administration of rescue medication and calling 911 if necessary. So, in summary, managing asthma in the Bronx requires a collective effort from teachers, healthcare providers, and parents. It's crucial for educators to recognize the asthma symptoms promptly, implement effective emergency response procedures, and encourage parents to initiate discussion with the healthcare providers to develop an asthma action plan for their children. Together, we can help children with asthma lead healthier lives. Thank you for your attention and the dedication of the well-being of our students.
Hi, my name is Mildred Cassiano, and I am the Director of Behavioral Health at Union Community Health Center. Today, I will be speaking about mental health issues impacting students. Let's look at identifying and understanding mental health symptoms in a school setting. In recent years, more so since the pandemic, addressing students' mental health has become a priority. Mental health problems can affect students' energy level, concentration, and their mental ability, which will impact their performance. Some students will present and convey symptoms like anxiety, depression, bullying, and ADHD. Anxiety can be present physically, emotionally, or through their behavior. Some students will present with stomach aches, headaches, dizziness, rapid heart rate, shortness of breath, and even sweating. Emotionally, some students may be very fearful, constantly worrying, irritable, and even sad. By their behavior, they will be refusing to go to school. They may even miss school, experience temper tantrum, crying spells, or even want to stay home, claiming they are sick. When we look at depression, research suggests that depression is associated with low grade point average. Depression can manifest itself through self-injuries, low energy level, difficulty concentrating. Some students may experience a decline in academic performance. They may become irritable, have a attendance issue, and a lack of a support system. So let's look at bullying. When it comes to bullying, always look for changes in the student as they exhibit warning signs. For those being bullied, they may present with low self-esteem, unexplainable injuries, headaches, and/or stomachache. Some may even experience sleep disturbances or even nightmares. For those bullying others, they may present as aggressive, impulsive, physical and verbal fights. They may have a contest popularity going on, or they may surround themselves with like-minded friends. When we look at ADHD, ADHD is one of the most common neurobehavior disorders in childhood, where there is a pattern of attention and hyperactivity and impulsivity that interferes with a student's functioning development. Some students may present with difficulties remaining still, fidgety, they may be unable to focus on tasks and/or complete tasks. Some you will find very excessive talking, interrupting conversations, impulsive, and even poor boundaries. So how do we create a safe environment to help minimize stigma and foster emotional resilience? When students are provided with a supportive environment, they can develop healthy coping skills and emotional regulation techniques that will give them the ability to overcome obstacles. Fostering a cultural environment of empathy and understanding and having open dialogue will help in destigmatizing mental health challenges. When students feel valued, understood, and supported, they will often stay engaged, and this will increase their motivation and enhance their emotional well-being. So let's take a look at accessing mental health services. Taking the first step in accessing mental health services is essential in order to improve the emotional well-being of students, but it can also be overwhelming. Upon meeting with a mental health professional for the first time, the student and their family will be asked various questions to become familiar with them. They will discuss treatment modalities such as individual and family therapy, along with methods which can be useful during the session, such as CBT, DBT, psychotherapy, and play therapy. So for resources, please view the following slide and let's work together to prioritize your students' mental health. Thank you.
Hello, my name is Dr. Renee Yearwood, and I am Director of Optometric Services at Union Community Health Center. Today, I'd like to address undiagnosed vision impairments. First, I'd like to start with recognizing signs of potential vision problems in students. Many kids who are having difficulty seeing the board will squint, copy from classmates, or ask to move closer to the board. Kids having focusing issues will sometimes not like to read, lose their place when reading, or complain of headaches with extended near tasks. They will also sometimes hold devices like phones and tablets or books extremely close to their face. The relationship between vision impairments and academic performance is very important. When students struggle to see clearly and comfortably, it hinders their ability to read, view classroom presentations, or even write legibly. This can lead to difficulties in understanding and retaining information, class participation, and completing assignments. Undiagnosed or unaddressed vision problems can affect the student's self-esteem and how they engage in the learning process. Collaborating with parents and vision specialists for timely interventions is also key. Early detection and interventions such as glasses or special classroom accommodations are crucial to ensuring that students with vision impairments can fully participate and succeed in their academic endeavors. Whether it's not seeing clearly or poorly functioning binocular or focusing systems, it is extremely important that both parents and teachers observe the visual habits of their children and students. Thank you.
Hello, my name is Miroslava Montes de Oca. I am an occupational therapist at Union Community Health Center. And today I'll briefly be discussing medical issues and conditions that may affect child performance in school-related activities. Attention Deficit Disorder, ADD, Attention Deficit Hyperactivity Disorder, known as ADHD, and third, Developmental Coordination Disorder, known as DCD. Attention problems are one of the core symptoms of attention deficit disorder and attention deficit hyperactivity disorder. It's a prevalent neurodevelopmental disorder that is characterized by challenges in attention, hyperactivity, or impulsive behavior. It's usually diagnosed in school-aged children. ADHD is more commonly diagnosed in boys than girls and almost 3 times as common. And it is often accompanied by some comorbidities, such as autism spectrum disorders and/or oppositional defiant disorders. Developmental Coordination Disorder, or DCD, is a neurodevelopmental condition characterized by poor motor proficiency that interferes with an individual's activities of daily living. DCD has been described as a hidden problem, with an estimated prevalence as high as 10% in school-aged children, and usually occurs 30 to 50% of children with ADHD. Movements of children with developmental coordination disorder are often described as clumsy and uncoordinated, and frequently leads to gross and fine motor performance difficulties. Difficulty with everyday activities that most of us take for granted, such as zipping a knapsack, using scissors, riding a bicycle, dressing, buttering a piece of bread, and even tying shoelaces. Other general difficulties commonly associated with DCD include poor fine and gross motor control, difficulties with speech fluency, abnormal muscle tone, referred to as hypo or hypertonia, and poor body awareness and gross motor sequencing. I'm going to discuss briefly identifying how ADD and ADHD might cause difficulties in class. Within the inattentive group, ADD, you might see characteristics like a lack of attention to detail, disorganized work and behavior, difficulty listening and concentrating, difficulty finishing tasks, and high distractibility. And these students tend to lose and forget things frequently. Now, within the hyperactivity impulsive group, ADHD, of systems, you might see a child that tends to fidget frequently, has difficulty sitting still, avoids leisurely play, talks excessively, and tends to have difficulty waiting their turn, or frequently interrupting others without being socially aware of such behavior. I'm going to briefly discuss how DCD, developmental coordination disorder, might cause difficulties at school. In their early preschool years, children with DCD can present with problems such as slow, immature, and laborious handwriting, and difficulties in copying from the blackboard. Many children with DCD also report lower levels of enjoyment in free play activities such as physical education classes or organized sports. Complications can be observed when children with DCD attempt to plan a motor task, when they try to organize their movements, when they perform a coordinated action, and when they adjust movements when demands change, such as moving fast to catch a ball. Children with developmental coordination disorder frequently withdraw from physical activities due to poor motor coordination and low perceived competency in sports, physical education classes, and during recess, while free play activities take place among peers. I will briefly discuss how there is support to help students with attention deficit disorder, attention deficit hyperactivity disorder, and developmental coordination disorder in order for them to meet academic, social, and physical and developmental milestones. For children with ADD and ADHD, occupational physical therapy might involve remedial strategies that aim to improve a child's concentration while working with the child to rule out all possible contributing factors to their symptoms. Since sensory processing plays an important role on a child being able to focus and attend to tasks typically in an environment that will have varying amounts of visual and auditory stimulation, the OT and PT can work with the student, parent, and teacher to determine what the just right level of stimulus is needed to improve his or her ability to focus and to minimize distraction. As one of the most difficult things for the student with ADD and ADHD to do is to remain organized, an OT can help the child find organizational tools, techniques to help them meet this goal. This can reduce the child's frustration, their stress, and improve their self-esteem by giving them a sense of accomplishment. OTs can help students with ADD and ADHD find a systematic way to initiate tasks, advance, and problem solve to get to the point of task completion. Children with developmental coordination disorder can also benefit from written tasks being broken down into steps, as motor planning requires organization of how written tasks must be structured before the written assignment is executed. Aids such as writing templates or checklists can be provided to guide the student through this process successfully and without it feeling like an overwhelming task to complete. Prompt identification of children exhibiting signs and symptoms of ADD and ADHD and or DCD by the teacher, by the physical education instructor, other educational staff members, or parents is the first step in finding the support and help that they need to help them overcome their academic and their physical challenges. In conclusion, I'd like to discuss when rehab services are needed. If a student is exhibiting any of these signs and symptoms discussed, and if they present an obstacle in child meeting their academic milestones, team meeting can be arranged with the school faculty and parents. Parent can then make an appointment for the child to be seen by a pediatrician to discuss concerns. And the pediatric MD can generate a referral for an OT or a PT evaluation and treatment if indicated, in addition to other health professionals. If an evaluation and treatment is indicated, other health professionals such as a neurodevelopmental psychologist can be involved in the process. If services cannot be provided at school, the child does have the option of receiving services in an outpatient clinic that offers after-school hours. Thank you.
Hello, everybody. My name is Dr. Neil Patel. I'm from UCHC Pediatric Dentistry, and I'm here to talk about dental caries. So what are dental caries, or as we more commonly know it, tooth decay? So it turns out that there are actually millions of organisms that live on our tongue and our teeth. So these are really beneficial organisms, bacteria, that help keep our immune system alive and running, but there are some bacteria that aren't as good, and these bacteria like to produce acid. And the acid, it can eat away at the structure of the teeth, the outer layer of the tooth called enamel, and make them weak. This is what we call a dental cavity. And what causes these dental cavities are bacteria that like to eat sugar. They eat the sugar and they produce the acid that then weakens the outer layers of our teeth to cause cavities. So I have a little picture here that shows dental caries at different stages. So over to the left here, we have a normal healthy tooth. To the right of that, we have what we call an incipient lesion. This is basically the initial weakening of the enamel, which can then progress into a cavity. But as I'll talk about later, there are certain things that we can do at this stage to help prevent cavities. The next one over, we have a well-formed cavity. Now at this stage, there's no reversing it. The only thing we can do at this point is place a filling. That can be a tooth-colored filling, it could be a silver-colored filling, it could be a variety of different fillings, but something would need to be done at this stage. The very last stage is a much bigger cavity. And when the cavities get very, very large, they can affect the inner layer of the tooth, which is called the nerve of the tooth. This can start to cause some pain and sensitivity to kids, and these are the kind of reasons why we might see emergency appointments or walk-ins at our clinic because of tooth pain like this. So what foods cause cavities? A lot of us know the common foods that we typically know cause cavities. These are things like candy, soda, juice, and cookies. They're all things that we know contain a lot of sugar and subsequently are prime culprits in causing cavities. The thing that we might not know is that there are a lot of other foods like white bread, potato chips, pretzels, or even milk that can cause cavities as well. And the reason is because a lot of these foods have either starch or sugar that we don't realize about. And the exposure to these kind of foods, especially the white breads and potato chips, not only can they break down into sugar within our mouths because they can contain a lot of starch, but they also stick around the teeth a lot more. So that can cause patients to be higher risk at developing cavities. And going off of that point, this is why exposure time to teeth matters. So drinking juice 3 times a day with meals is actually a lot better than sipping on the same amount throughout the day, because sipping on that juice every couple minutes, every 20 minutes or so, exposes your teeth to a lot more sugar than that same amount at 3 times a day with meals, because at that time now you have a lot of other things like the other food you're eating or saliva that helps wash away some of that acid producing bacteria and those sugary foods. So the reason we care about this so much is because there are a lot of issues that can cause difficulty in school for kids, and this happens in a number of ways. The first way is that kids can develop pain at school. And as we all know, pain makes it difficult to concentrate on what we're doing at the time. And for kids, that means that they're not really focusing in class anymore. And in some instances, if the pain's really, really bad, kids might not even want to eat at lunchtime or during snack time, and that can lead to malnourishment as well. The other thing is that kids can miss school as well because of emergency visits to the dentist caused by pain, like I was mentioning before, or if they go to the dentist and we know that we need to do multiple fillings over multiple appointments, well, now they're being taken out of school to get those fillings done, and now they don't have as much time to concentrate on the schoolwork that they're missing. And the other big thing is a lack of social engagement. These are the times where kids might be at recess or going to after-school activities such as sports, dance class, music, all these things that the amount of time that's focused on dentistry is now being taken away from these things. And specifically at recess, if kids are worried about dental pain or how their teeth look, that may be a thing stopping them from socializing as much as they could. And we know that socialization at this age is really important for children's development. So how can we help our students? The biggest thing we can do is an early establishment of a dental home. So a dental home being a dentist that both the kids and the parents can reliably go to for regular checkups and if they need any treatment. We generally recommend that a dental home is established no later than age 12 months. At this age, kids start to developing some teeth, and this is the perfect age for we as dentists to talk to the parents about their dental habits in terms of diet and brushing to make sure that they're doing the right things. And it also gives chance for kids to get exposed to the dentist so that they're not so scared in the future. And like I mentioned, it's the best chance for regular visits and prevention of caries in the future. The other thing we can do are school screenings. This could be either me, the dentist, or a hygienist that we have in this clinic to go to these schools and help screen some of these kids. A lot of these kids that maybe don't have a dental home and maybe have some untreated cavities. So we're promoting two things. One is primary prevention. So these are the things to help prevent caries from happening in the first place. So that includes teeth cleanings we can do, sealants, which are protective paints on some permanent teeth to help prevent cavities, and then applying fluoride vitamins as well. The other thing we can do is secondary prevention. So these are the situations, like I mentioned before, where we have the beginning of the weakening enamel, but there is something we can do about it. So these are the two things that we mainly can do about it. It's either applying a medication called silver diamine fluoride or prescribing a toothpaste called Prevident. So these are high concentrations of fluoride, which can help target specific teeth to help prevent cavities in areas where we know cavities are starting to develop. So when should we refer to a dentist? This has a lot to do with pain, and the pain can be caused by a lot of different things, but the things we kind of look for are hot and cold sensitive teeth, or pain that's coming out of nowhere or happening at nighttime. These are kind of indications that you might want to pull a kid out of school and send them to the dentist to have that tooth be looked at. And the other thing that you would want to refer to the dentist to are kids that have a lot of untreated caries. So these are kids that have maybe yellow, discolored teeth, and kids that are clearly not getting the treatment from their parents, whether it's they're not bringing them to the dentist or they don't have the right resources, they don't have the right information. So these are the kind of situations where we would want to refer to a dentist as well. So I hope this presentation was very educational for everybody. It's really important that we take the best care of our kids as possible and help them do the best they can in school. And as we all know, regular visits to the dentist for fillings, crowns, all this stuff can be very burdensome for both the kid and the parent. So the best thing we can do to prevent those issues from happening are every 6 months getting checkups for pictures, for cleanings, to check for cavities, and also proper home care as well. So I hope everybody enjoyed today's presentation and have a great day.
In today's session, we have covered important topics such as asthma, behavioral health, dental, vision, and physical therapy. We sincerely hope you found the information valuable. It's been an honor sharing this time with you. On behalf of Union Community Health Center, we want to thank the Honorable Borough President Gibson and our team of outstanding clinicians for sharing their expertise in an effort to come together for the health of our Bronx youth. Together, we will continue to strive for a great future for our children.